A 62-year-old woman is brought to the emergency of a busy suburban hospital because of 1 week history of nausea and vomiting. She also had intermittent fever, headache for last 5 weeks. She does not have a stiff neck or sensitivity to light. She appears tired and the temperature is 37 degrees centigrade. Pulse is 70 and respiration is 15. Blood pressure is 135/85. She is alert, oriented to person, place, and time. Examination shows no abnormality. A lumbar puncture is performed. CSF is collected for analysis. On the way to laboratory, the physician loses the CSF specimen. The physician decided that to repeat the lumbar puncture should be performed. Before giving a consent for a second procedure, a patient asked what the results are from specimen obtained earlier. Which of the following response physician should do? So we just discussed whenever we do any kind of error, yes. So the answer here is we should own up to our mistakes and we should tell them and apologize for the mistake. So the answer here is B. So we should able to obtain the physician could say, I was unable to obtain results from earlier because I misplaced the specimen. I sincerely apologize. So this can decrease the, if anything, other response can increase likelihood of lawsuit. Okay. Let's see. Sincerely apologize and I misplaced. Thank you for not being this is not a big issue because I can always, you should not say statement like this. This is very judgmental. And as I said, in ethics, you have to be very polite with the patient. I was not able to get answers needed for the first set of treatment. We need to repeat them. This is live. The physician is training because patient never got it tested. Unfortunately, I was not able to get fluid in the enough fluid. Still, patient is not, the physician is not accepting the error that he made, and we should. I sincerely apologize. Lab seem to have. This is an inappropriate response. Okay. So answer to this question is you have to own up to the mistake and tell the patient.
Thanks for watching. Please give a thumbs up and subscribe for more.